Hello, everybody, and welcome. I go by the name of David Rush. I would like to welcome you all. Hope you guys are having a great evening, and hoping you guys are in for a good topic with us. We're going to be talking about adjusting to life after transplant. So, this being Kidney Month, shout out to all my transplant recipients, my donors. The importance of knowing about transplant, me being on both sides of transplant, I'm happy to be here to discuss about how we care about our kidney after transplant, share post-transplant outcomes, complications, and we're going to give some tips on how to adapt to the new normal with your new transplant. So let's get into this. I'm going to introduce my speakers first. I want to introduce Dr. Norman. Dr. Norman is a transplant nephrologist, clinical professor and the co-medical director of the kidney and pancreas transplantation at the University of Michigan. Dr. Norman is the chair of the American Kidney Fund Board of Trustees and the past chair of the American Society of Transplantation Inclusion, Diversity, Equity, and Access to Life, IDEAL Committee. Dr. Norman's research is focused on reducing health disparities in kidney transplantation and the evaluation of the medical, frailty. Dr. Norman, thank you so much for being here. How are you doing today, sir?
Doing well. Thank you.
Good to have you here. I'm going to also introduce my man, Evan. Evan has a unique story. He was diagnosed with a kidney disease at 8 years old and started experiencing kidney failure when he was 27. After making many changes to his lifestyle, including losing 100 pounds, which is something we got to get on the phone, man. You got to tell me how you did that, all right? We're going to have a discussion after this. He was put on the wait list to receive a deceased donor kidney December 9th, 2016. Now, 7 years post-transplant, Evan is healthier than ever and here to share his story and experience after transplant. Evan, welcome, man, and I can't wait to hear your great story, my brother.
Thank you so much, David. I'm so happy to be here. Appreciate it.
Yes, sir. Yes, sir. So before we get started, guys, I want to encourage you guys here who are in tune, please go ahead and put some information into the chat, questions you may have. We will try and get to your questions. We have a 30-minute window, so we'll do our best to get to those. We're going to give you some good resources and stuff today. But if we don't get to your question, please don't think we did it on purpose. We're just going to give you as much information as we can, and we're going to get into it first. So I'm going to start us off today. I'd like to turn it over to Dr. Norman to share about the importance of taking care of your new kidney and what this care looks like and some post-transplant outcome. Dr. Norman, the floor is yours.
Great. Thank you. Thank you so much. And good afternoon, everyone. Thank you for joining us. Next slide. So we'll talk a little bit about kidney transplant outcomes to begin with. The benefits of a kidney transplant. We talk a lot about how kidney transplant is better than dialysis. And what do we mean specifically? Well, we know that in general, a kidney transplant increases your chance of living longer compared to dialysis. And we know that most people feel better than they did on dialysis. And then from a cost perspective, we know that over the length of the transplant, over the course of this treatment, transplant's going to be less expensive, both for you as an individual, as well as for the health system compared to being on dialysis. And you can see pictured below what we expect in terms of some of the survival, 5-year survival rates, around 40% for dialysis, and you can see that it's substantially better for kidney transplantation. Next slide. But there are some challenges. We remember that kidney transplant is a treatment and not a cure. And so this slide shows us the chances of a transplant failing over a 10-year period. Now, you can see compared to 40% of people who are likely to be alive after 5 years on dialysis, that right around 50% of people 10 years out still have a graft that's functioning. Even though for many people at 10 years, the kidney may have failed for a variety of reasons, often the patient outlives that graft. And so what we want to do is think about how we can make that kidney transplant last as long as possible, make sure people do as well for as long as possible. Next slide. So let's think about the importance of really taking care of this gift, taking care of this kidney transplant. We know that unfortunately, through the course of transplant, the body may reject this new kidney, resulting in either some kidney injury or occasionally the transplant failing. We know that if people have a rejection episode, That treatment of that rejection episode may require people to stay in the hospital, and almost certainly will expose you to more immune system suppressing medications. And we know that not everybody's kidney function gets back to normal, back to its baseline after treatment for rejection. In addition, we know that rejection and certainly kidney failure can bring about additional substantial emotional impacts as well as financial costs in addition to the medical issues. We know that the reason that people's kidney transplants may be injured, may fail over time, there's a lot of different reasons. But we know that often that can be due to people not having adequate amounts of transplant medication in their system. Can result sometimes from people getting certain infections. And sometimes people even get some long-term injury from the transplant medicines themselves. Because of these risks, it's really, really important that we closely monitor kidney health after transplantation to help make sure that this transplant lasts as long as possible. Next slide, please. Really, really important is that as patients, we empower ourselves to take care of this transplant. What can we do? The first thing is really to make sure that we're being a partner in our care with the transplant center. We want to make sure that we're making it to all of our scheduled appointments, getting our labs regularly so we know what our numbers look like. Really critical is making sure that your transplant center knows any concerns that you have, any changes in your health, so that they can best help make sure things are on track. Want to make sure, really importantly, that your transplant center is aware of any changes in your insurance or any issues that you have affording medication so that we can help. Make sure that you're drinking enough water every day. That kidney needs to stay well hydrated. And of course, making sure that we're making healthy food choices so that we're in the best shape as possible. Next slide. We know that the after transplant care period can be really complicated. There's a lot to do, not the least of which are the labs and the visits. You can see pictured here on this timeline, early after transplant, we're often getting blood work done twice a week. People are often having visits once a week, and then you move out to the 1 to 3 month period. That decreases a little bit. By the time people are in that 3 to 12 month period, people are still probably getting having visits every 1 to 3 months. People are still likely having blood drawn every 2 to 4 weeks. So there can be a lot to keep up with, but it's really important. And then really important is that after a year out, after things have kind of settled down, people are doing well, it's really important to realize that there's still blood draws that need to happen at a regular cadence and visits that need to happen at a regular cadence. Next slide. This looks at health disparity. So we know that transplant overall does really well for a number of people, and it's increasingly been getting better. And what this slide shows us is from the period between 2000 and 2015, broken down by different ethnicities, what survival looked like after 5 years of transplantation. And you can see in 2000, if you just look at the red line, this looks at African Americans, you can see that back in 2000, at 5 years, we only thought about a 50% chance that the kidney would still be working. And you can see that for every ethnicity, that's really improved over the last 15 and now 20 years, where we've been steadily doing better for individuals having those kidneys last longer. But you can also see by the spread in those different lines for different ethnicities that not everybody's getting the same benefit from kidney transplantation. There's a lot of reasons for that, but increasingly we recognize that those are some of what we now talk about as the social determinants of health. The income people have, education, where people live, what resources they have available, access to healthy food, those kind of things that may be driving some of these differences. And so there's an opportunity both for patients and both for those of us in the transplant center to get together and make sure that we're minimizing as many of those impacts on people so that they can have as good an outcome as possible. Next slide. There's a number of complications that people can have after transplant, and this slide shouldn't concern people that there's a lot of them, because each of these, whether they're surgical issues or infections, cardiovascular complications, Many of these can be managed if we just stay on top of our medical care, make sure that we're communicating effectively, issues we're having, concerns we're having. The two things I'd like to stress, though, that we don't often talk about, one is mental health. And I think you'll hear more about this this afternoon. Many of our patients, it's not uncommon, have some feelings of depression or guilt. Easy for people to feel overwhelmed by all the things that we ask people to do. There's medicine-related side effects, and sometimes people's pre-existing conditions can get worse. And these are perfectly normal things that happen, but things that should be discussed with your transplant team so that we can help you out and you don't have to feel like you're the only person having some of these issues. And then the financial challenges. Life can happen to people. People can lose their jobs, lose their disability. Insurance can change in ways that make them harder to maintain their transplant. Again, happens more than we would like to see, but you're not alone with this, so make sure that you're talking to your transplant team. Next slide. Nobody wants to talk about money and no one wants to talk about what's going on, but it's important to talk to us if you're having financial challenges because we often have ways to help. And we unfortunately, every year see some rejections that are ultimately really driven by money, that people couldn't afford their medical care, couldn't afford their medications, and we don't need that to happen. So please make sure you engage your transplant team. We have a lot of assistance programs to help. We just need to know about what's going on so we can jump in there and partner with you. Next slide. And then think about some resources we have available for you. Really important, talk that communication with you and your transplant center. If you're having some mental health challenges, we have usually psychiatry and or psychology services available, along with a lot of information on local referrals, community mental health resources. We have a number of peer mentors that are people who have been transplanted themselves, who really have walked this walk and can really be often more helpful than we as physicians can be to help you navigate some of these challenges. We've got a great pharmacy team that can help you with medicine side effects, talk to you about copays, financial coordinators who can really address some of these thorny financial issues, insurance issues. And then there's a lot of other resources, for instance, on the American Kidney Fund website that has a lot of information about mental health and support after transplant. Next slide. So quick key takeaways. We know that adjusting to transplant isn't a one and done. It's an ongoing process. There's going to be some bumps in the road for some of our patients, but the Transplant Center is really here for you and to support you. Make sure you maintain good communication with the Transplant Center so that we can really provide you and help you towards the best outcome. And just remember, there's a lot of resources out there for you to help support you and make sure you have the best outcomes. Next slide. Thank you, and we'll happy to take questions at the end of the talks.
Thank you so much, Dr. Norman. Really appreciate that. Some great information, great insight. Being a patient, a lot of those things did hit home for me as well. Being post-transplant and pre-transplant, and thank you so much for that. We have some questions coming in for you that we will get to after our next speaker. So hold tight for us, please, Dr. Norman. Don't go nowhere. People got some questions for you, man. So we'll get back to you in a minute. I want to transition over, guys. Remember to continue putting questions in the chat. We are getting the questions sent over. Like I said, once we finish the segment with both of our speakers, we will try our best to get to your questions. If not, we'll be sure to send them off and get them to you at a later date. We're going to transition over to Evan. Evan, thank you so much for walking through your transplant with us, man. I want to get your story. I heard a little bit of it before. We didn't really get to hear the whole thing. And I'm sure this won't be the whole thing, but I want to give a little bit of your story as well and your experience since you've gotten your new transplant and the road to getting there and the road that has been after, man. So I want to turn it after to you and excited to hear what you got to say. Thank you so much. The floor is yours.
Thank you, Dave. Appreciate the introduction. Also want to thank Dr. Norman. It's always great to be reminded of the importance of post-transplant care. So yeah, my name is Evan Dame. Good afternoon, everybody. I am a transplant recipient of 7.5 years now. I was diagnosed with kidney disease at 8 years old. And it progressed my childhood, and eventually my kidneys failed due to lack of healthcare. Unfortunately, I didn't have health insurance as a young adult, so I wasn't able to obtain the medications and the healthcare I needed to manage my high blood pressure, which ultimately is what caused my kidneys to fail. And um, when I started dialysis, it was an extremely difficult ordeal, as some of you may know who dialysis. It caused me to fall deeply into depression, which then resulted in me eating foods that I shouldn't eat because I found comfort in it. And this led me to gaining pounds. I was already heavy, but then I ballooned to a weight of nearly 360 pounds while on dialysis. Of course, this only exacerbated my condition. Once I reached the 5-year mark, I had received several warnings and nurses that after 5 years, your heart starts to sustain permanent damage. You can become at risk of heart failure and heart disease. And at my age at the time, that was a scary prospect. I didn't want to die so young because I had a lot of life to live and I had a lot of goals that I wanted to accomplish. So with the help of my dietitian Plant Center, I started to um, plan and adapt a lifestyle change. I started to eat better. I started to exercise when I could because, as you know, dialysis is extremely draining. So you can do physically unless you just really, really push yourself. And so after about a year or so of that, I finally made the weight or the BMI needed to get transplanted. Called to George Washington University, and I went through the necessary steps and procedures to get listed. And fortunately, when I went to get listed, they had enacted the mandate that dialysis is counted toward wait time. So when I was listed, it was as if I had been on the list for 5+ years. So fortunately, I was on the list for 6 months before that fateful call on December 7th of 2016. And oddly enough, I was actually the runner up for the kidney that was available. So I really wasn't expecting a call back, but I received the call. Immediately, I went to the hospital, and they run all kind of pre-transplant or pre-surgical tests before they have to do the transplant because they have to ensure that outside of your kidney failure, they have good enough health to make it through the surgery. So surgery went well, and then I was in ICU for a couple of days, and then transported to the general regular patient stay, and I was discharged within 5 days of my transplant. However, I was immediately called back because my creatinine skyrocketed. So they feel fortunately, it was not rejection, it was dehydration due to some side effects of the medication. So once I was hydrated, and my levels started to come down, but it was extremely scary because, you're at high when you're immediately transplanted. So my anxiety levels were extremely high, and I was on high doses of prednisone. So I was shaking and trembling. I couldn't sleep. It's an ordeal that, I hope I don't have my lifetime to receive a transplant and to think you're immediately losing it. Some of the biggest changes after transplant was getting used to drinking water again or fluids in general because you're on such rigid restrictions. So to be encouraged to drink, 3 or 4 liters a day was very, very difficult to do. But I finally got adjusted to it because water is one of the most important things to do as a transplant recipient because you want to stay hydrated so that your creatinine and your other electrolytes remain stable. Another thing that occurred maybe 9 months after transplant, I would say, is the yes in my kidneys had returned. So that was another moment of uncertainty that really heightened my anxiety. Fortunately, they caught it in time and was able to treat it with plasmapheresis. thanks be to God, I haven't had any issues with it since, and I hope I never do. So some of the resources I've tapped into to treat my anxiety is group at my transplant center, which has really helped with talking with other transplant patients who have had similar experiences. I have started going to therapy, which has been a tremendous help because any kind of illness, particularly a chronic illness that there's no cure for, causes significant mental trauma. Just being on dialysis, being in the ICU, going through surgery. I mean, most of us have experienced trauma no one else will ever even imagine. And so that leaves its own emotional and psychological scars that have to be treated. And so, therapy and a support group has helped me tremendously. That is, outside of drinking water and taking your medication, that is one thing that I encourage all post-transplant, pre-transplant dialysis patients to do is please care for your mental health because it helps a lot in the long run. Thank you. Appreciate it.
Thank you so much, Damon. I appreciate that, Evan, man. That was it almost sounds like I was listening to a mirror a little bit, hearing your story and knowing my story. I know we said we had to talk offline, and we'll be, I'm sure we'll get the chance to do that. We'll get connected outside of here. Dealing with being a transplant recipient myself in 2010, and then losing it in late 2017, 2018, my transplant from my brother, having a living donor. I set the date, we did the transplant. I had the kidney, and I also too, had FSGS as well, and it ended up returning. And I remember going through the anxiety, and it is almost like a trauma for patients. One, being in dialysis, going in there and seeing somebody that's in the chair that you're in not show up the next week, and you're sitting there like, when is it my turn? You know what I mean? And then people think, even going through transplant and doing all the tests that you have to do, it's like taking your car to go get new brakes. You go there for brakes and they tell you your transmission blown, and you got to get all this stuff done before you even get what you came for. You know what I mean? So the trauma anxiety of it is definitely a thing. I'm thankful for you guys tapping in on that. I don't want to waste too much time. We do have a couple questions I would love for us to get to from the people. Dr. Norman, first question is for you. Is there a loss in kidney function for a donor, or is there increased risk of development something like high blood pressure if you donate a kidney?
Sure. No, that's a great question, and certainly we promote living kidney donation whenever possible because it affords the best outcome for people. For the donor, if you start with 100% normal kidney function, right at the time when we take one kidney out, you'll be down to 50% normal kidney function. Over time, that kidney will grow and adapt a little bit, so that long-term people should end up with around 65 to 70% of the kidney function that they started with, which should be more than enough for the rest of their lives. And then in terms of future risk, in general, not too many. There's a very, very small future risk that people might develop high blood pressure that they wouldn't as a result of their donation. And there's some regular follow-up of donors that happens after donation at transplant centers purposely to try to make sure that donors are staying healthy so that we can continue to do living kidney donation.
Thank you so much. Evan, I'm going to ask you a question. Being now that you lost the weight, you're doing now, I know drinking you said was the issue and stuff like that. How has your health changed as far as what you're eating, what you're putting in your body now that you have that kidney for the 7 years? What are you doing to maintain?
One thing, I exercise every morning. One, for my overall physical health, but also is great for my mental health. Two, I've cut way back on junk, like sweets and things high in salt. Everything I buy is like no salt, low salt. Except around the holidays, you gotta have fun sometimes. But I do my best. Do my fruits and vegetables every day, and ensure that my portions are in control, and just do any person, even if they don't have kidney disease, try to eat healthy in general.
Okay. Dr. Norman, can you speak to the connection between, I don't want to mix this word up, Paxlovid and its effect on transplant recipients? Did I say that right?
Yeah, no, absolutely. Paxlovid is an oral medication for COVID-19 that people can take early in the infection and helps make the infection not as severe. For our patients, at this point in our center, we don't prescribe that to our patients. One of the components of Paxlovid is what we call a very potent inhibitor of breakdown of the transplant medications, such that people's drug levels, that should be around 5 can easily go up to 30, 40, 50 with just 2 or 3 doses. And that can cause kidney damage. And so just stresses that any new medication you're going to take, even if you're in an emergency room, you really need to talk to your transplant center before you start.
I want to make this a double-sided question. Dr. Norman, first you can jump in, and then I'm going to make it a double-sided question for Evan. After a transplanted kidney fails, do patients typically go back on dialysis until they can get another transplant? Then I want to flip it and say, too, Evan, having FSGS and losing my kidney and then having to get back on dialysis was kind of a shaky road for me. And even having to go back to a CBC at one point again, and it felt like starting over. What if the future holds for you, which I want this kidney to last you for hundreds of years. If you ever had to go back to that, what would be the way that you think that you would transition back, as a question for you. So Dr. Norman, after transplant, kidney fails, do patients typically go back on dialysis till they get another one? And Evan, after, God willing, you keep this kidney forever, if there's ever time you did have to go back on dialysis, what modality and what choice would you want when you go back? But you're not going back.
Yeah, so that's a great question. So the short answer is yes. And like you said, you may have experienced some people who have disease that comes back and the kidney may decline quickly, may have to go back on dialysis before a new transplant. Whenever possible, we like to transplant people before they're on dialysis. So even among our transplant patients, whenever we can, if we see the transplant is declining, we would try to get you reevaluated and placed back on the list before you're on dialysis, and ideally get you that second transplant before ever needing dialysis.
That's good. I've never heard that one. That's cool. Evan, what do you think?
Thank you, Dr. Norman. So yeah, I've given this some thought because this is something every transplant patient thinks about every single day. So I think I would approach it a bit differently than before because I have more information. And I think I would opt for at home instead of in center next time, and it would give me more flexibility. And now with teleworking capabilities, it wouldn't affect my job as much as being on dialysis did previously when I had to be in the office day. So yeah, it's definitely I hope it lasts forever. Like you said, David, prayers. But yeah, I think I will. At least I'm more prepared now since I've been through it already.
I think I feel that way too about transplant. I had one already. Going back into trying to get my second one, I'm definitely taking a little bit slower and trying to financially save the money up, trying to make sure the family's good. I know sometimes doctors want you to jump right back in, and I'm just like, hey, hold up a minute. I'm not ready for it yet. I've had one. These steps have to be taken now that I know I can kind of control the narrative. And I think patients need to understand that they do have a voice. Number one, they do, you can speak to your doctor. You can ask those questions. It's okay to say, hey, doc, I'm not ready, and kind of weigh out your options that way. Patients just need to remember that as well. And thankful to the doctors that do listen and give that information to their patients. All right, guys, I want to thank you guys so much, man. My panelists here for this discussion. It was healthy. It was good to hear from both ends, doctor and patient, recipient, even myself still being on dialysis. It's grateful to hear all perspectives from you, Dr. Norman, and from you, Evan. I want to give you guys continued success on everything you're doing. And I want to thank the audience for the questions. I want to thank everybody who tuned in to this whole Kidney Action Week, man. It's been awesome. American Kidney Fund, thank you so much for the sponsor. So that's it for today. Tomorrow, I want you to tune in again to hear about AKF's Unknown Causes of Kidney Disease project. All right, this is year 4. This is tomorrow at 10 a.m. And I was at the summit for this, guys. It's something you do not want to miss. I got a lot of great information. So tune into that tomorrow at 10 a.m. for AKF's Unknown Causes of Kidney Disease Project. Follow us on Facebook. Send an email through kidneyfund.org about resources. If it's something you saw in here that you want to get retouched in about, make sure you email us at kidneyfund.org and we'll get that resources over to you. Dr. Norman, Evan, thank you so much, man. Enjoy the rest of your day. Thank you to everybody who tuned in. We appreciate you. And wins only, man. Have a great evening. Thank you so much.
You too.